Hey guys, I am the nurse Dr. Asia. So today we will be opening an ampule and administering an intramuscular injection. So let's get started. So first I'm going to perform hand hygiene. All right, so what are the things that you need? You're going to need your medications, which is the ampule. You're going to need an alcohol pad and some gauze. And you're going to need a filter needle. You guys, it is so important. You need a filter needle. So why do you need a filter needle? You need a filter needle because once we crack this ampule, this is glass. So we want to make sure that when we are pulling up the medication that we're not giving the patient any glass. So the way to ensure that is by using a filter needle, okay? And then we also going to get us a needle and a syringe for our IM injection. So I have a 3 ml syringe and my gauge is going to be 23 gauge and it is going to be a 1 inch. Go ahead and put on my gloves. All right, so now that my gloves are on, I'm going to get my ampule right here. So first what I'm going to do is I'm going to take an alcohol wipe and I'm going to clean around the neck of the ampule. All right, so I'm going to let that dry. So after this finished drying, I'm then going to take it. So you're going to take your gauze and then you're going to just grip it like this and then you're going to go over here and then you're going to break it. All right, so you want to make sure that your little glass neck is intact. All right, so now that we have our ampule open, just gonna sit it to the side. So now let's get the syringe and we're gonna pull up the desired ordered amount. So I'm just gonna pull up 1 ml. So I'm gonna attach my filter needle just like this. Take the cap off, and then I'm going to pull out the desired amount. Now, with ampules, it's so important to know that you can flip your ampule upside down, which is inverted. You can do that and not have to worry about any medication spilling. Got my desired amount. So now, I'm gonna take the safety cap, put it on there, and then I'm going to twist this part off. So you guys remember that when you are using a filter needle, you're only using the filter needle to retrieve the medication. After that, you want to make sure that you put on the correct needle. So what we're going to do now, we're going to attach the correct needle. All right, so we're going to go ahead and cleanse the patient's skin. And this is a intramuscular injection, so I'm going to give it in a deltoid. And we're going to let that dry. All right, so we are going to give this using the Z-track method. So with the Z-track method, all we're going to do is just pull our skin to the side. And then we're going to use the dart method. We're going to go straight down at a 90-degree angle. So you want to let your patient know that this may hurt. Okay, so we're going to go straight down, 1, 2, 3. And we're going to push the medication in. All right, then you want to allow the medication, you want to allow the needle to stay in for a little while. And then we're going to pull it out. After we have the needle out, we now can let the skin go back. After we give the injection, we do want to activate our safety. So we're going to push this up. And there you go. So I just want to thank you guys for watching this video. I hope that you learn how to open an ampule and give a intramuscular injection.